Hey everyone, it's Dr. Mike, the Lung Doc, reaching out to you after the declaration from the Hamilton County talking about mandatory use of masks. So, obviously, in the coronavirus pandemic, uptick in cases, we've been very busy. We have been emphasizing throughout hand washing, social distancing, not touching your face, and certainly wearing a mask when appropriate. And now, as we know, we want a mandatory mask use. I believe until September is what the Hamilton County order says, which we support. And we encourage all our patients and community out there to also wear masks. Mask, basically three varieties. We've talked about them before: cloth coverings or cloth face shields of some sort, surgical masks, and then the N95 mask. So I have an example here of surgical mask. Certainly, probably the preferred mask to have if you're out interacting with people in a close environment or a closed, unventilated space. If you're in a procedure or in a healthcare environment, an N95 is the best type of mask. And then below this, which I'm wearing, and you don't have to do what I'm doing, but I just want to demonstrate a typical neck gaiter type of face mask or face shield. Not as effective as a surgical mask, definitely not as effective as a N95, but is an option that you can have out in the community. The recommendation on the orders from the community health department and the county mayor is to have a face shield or face covering and mask at all times indoors, no matter the situation. And then when you're out, if you're in a restaurant eating, that'd be fine to take your mask off, obviously. And if you're outside in social distancing, I believe the mask says it's okay if you're by yourself to not have a mask on during that time if you're in a small group and with proper distancing. Of course, always hand wash and don't touch your face before washing your hands. I just washed my hands now before starting this. So very important to try to continue to cover your face and cover your nose and your mouth. I'm uncovering right here, so this is a typical type of neck gaiter, and like I said, the surgical mask is an appropriate alternative. They're readily available now. And then the N95s, we encourage you, if you have availability and access to them, to use them as well if you're going to be in a little bit more high risk situation. We use the N95 masks in the hospital, and as well as some face shields and to protect our eyes. The concerns is we're still collecting data in terms of droplets versus airborne precautions. Droplets basically mean when you talk, droplet, heavier piece of spit basically can come out of your mouth and drop close to you down to the ground and stays on a surface. And then if you touch it, you now have it on your hands and you rub your eyes or something like that, and you can catch your or spread the coronavirus. Airborne or aerosolized tends to go out, smaller particles, and floats in the air, and then you breathe it in. So the masks are really designed to help people who may be asymptomatic carriers or asymptomatic, don't realize it yet, to reduce that distance so that if you're standing 6 feet away, it doesn't spread, but only 3 feet with the mask on, or maybe even less than that. As we get more information, we will get that out to you. But again, we support the mandatory use of face masks. We'll keep you updated. There's lots of options out there. We look forward to helping you breathe better again and continue to give you good data and information during this pandemic. We're here to support you. If you need us, let us know. This is Dr. Mike. Bye-bye.